ask question. Now, what are the conditions that require referral? What are the conditions? What are the problems that we need referral? Who can tell me? Prolonged labor. All gynecological problems. That's what I said, Ko? Yes. All conditions that require referral. This gynecological problem can be prolonged labor. Labor that lasts for more than how many hours? How many hours in primigravida? And how many hours in multigravida? I told you last time. 36 hours. Any labor that lasts for more than 36 hours in primigravida, and anyone that lasts for more than 18 hours in what? In multigravida, it requires referral. I say prolonged labor. Prolonged labor can be in form of retained placenta. Prolonged labor can be in form of bleeding, severe antepartum what? Hemorrhage. When the woman bleeds, even before delivery of a placenta whatsoever, when there is eclampsia or pre-eclampsia that require your intervention. So all these things that delay for more than 36 hours as a result of delivery, as a result of maybe labor or puerperium. You know puerperium? The condition that lasts after delivery up to 3 weeks to 6 weeks. So these conditions need what? Referral. Then all cases, all conditions that require surgical what? Intervention. Cases or conditions that requires surgical intervention, it needs referral. In at your own level, your own primary assignment is promotive, preventive, and what? Preventive care services, including some of your rehabilitative care services. So you don't do major surgeries. So all cases that require surgical intervention like what? Herniorrhaphy, appendectomy, cesarean section, all these things, they require what? Referral. Then all cases that requires major diagnostic services. Just take this one that I'm giving you. Diagnostic what? Services. There are some things that require laboratory investigation. You don't have the skilled staff. You may not have the instrument to carry out this. So you need to refer these cases. All cases that require specialist care or intervention, it needs referral. Specialist care, like specialist nurses, like specialist midwife, like specialist what? Doctor. Have you ever seen children that is being born or less than 7 months, 8 months, that require incubation? You don't have incubator, you have to send it to where they can be incubated. They need proper temperature, they need proper environment, and you don't have it. What do? You refer to where they can be able to obtain all those things. Then these are the cases. These are the major cases that require your intervention, that require your what? Referral. Then the last thing. Yes. Diagnostic services. Then what are the problems? Problems that intervene or prevent referral to be effective. I told you already. What are they? First one, poor road network.
Distance.
Patient refer to a very long distance health facility.
Yes.
Then 3. Which one again? Lack of funds or money, capital for patient referred to travel.
Yes.
Go. Then which one again? Which one again? Patient refusing referral. Then what again? ETC. What again? What again? Natural what? Natural disaster or barriers. Phenomenon. Barrier. E.g. example. When the rain, wind, unconditional environment. So if you have a question, please ask. That is for two-way referral system for now. The next time when I come, we'll come along with outreach call. The next thing is outreach services. If you have a question, ask question. You don't understand it, okay? If you didn't ask question, you don't understand the lectures. Did you get it? I ask question.
You are thinking of one day before.
When?
Back to the exam. I have started already.
I'm aware. Yes. It's all it's continuation of the time version of the referral. Look at this thing. Check your page. Check your page 9. Check your page 9. You see, after immunization, there is BCG, polio, whatsoever. Check down. There is what? Please stay below and return to where? Please stay below and return to where? Check it. You didn't see it? Referring officer. So they will tear this thing below and complete it for you. They will refer it back to you. These are the information that they require. You see the donation signature and date code. Just go back. This one is attached to what? To the referral form. This form here is attached to what? They say from your own health facility. The day that you are referring the patient. To where? The patient, the place where you are referring your patient to. I'm referring the above named patient, stroke client, to your health facility. The patient age, gender, either male or female. Go. Personal number. Remember in our supervised community-based experience, we say we have cards. We have cleaning master card, we have personal hair card, and we have what? Child hair card. So apart from the house number, remember I told you that we give assign number to individual houses to facilitate referral and follow up of patients. Go. So now apart from the house number, the people that are living inside the house are also numbered with the given PAC number. That number that you assign during your supervised community-based experience, that is the number you use here. It's of two types. We have child health card and what? Personal health card. And each card of this card is assigned with number. The first number there is the household head as 01. Remember that time. Remember that we discussed this thing. 01 is the household head. There is 03, no 02. If you have 02, you will not have 01. If you have 01, you will not have 02. Remember last time? Then I say 03 to 19 are the number of wives. 20 to 59 are the number of children. 50 to 59 are the number of grandchildren. You remember all this thing now? Then 60 to 69 grandchildren. 70 to 79 dependent. 80 to 89 are household. I gave you this thing. This thing is seen inside the cleaning master card. The card that you assign to every household. So now the personal number is the number of